I had been referred to Dr. Halgamo or recommended to Dr. Halgamo from a neurologist in Fort Myers. I had had previous surgery on my left hand that was not satisfactory, and came to Dr. Halgamo to have him look at it and evaluate it, and actually had to evaluate both my hands. Previously, I had had an open carpal tunnel on my left hand last February, and I had a radial arm release in my left arm. And following that, I had severe pains in my left hand that felt like knitting needles were being jammed in my hand. And the physician felt strongly that it's something called RSD, and that it had nothing to do with the surgery, that I had a degenerative disease in my arm. The symptoms that I had increased atrophy in my left arm, and I was losing strength in my hand, and my hand was going to sleep all the time, the first 3 fingers. I was just picking up a pan was getting heavier and heavier. I work with horses, and hanging on to my horse was difficult. I like to fish and ski, and I noticed my palm of my hand was hurting. I was doing snowshoeing, and I'd get home from that, get back from that, and my hands would just ache and ache and ache. When I called up, I got an appointment with just a couple of days. Dr. Halgamo was very warm and receptive and very positive about what could be done, and he was very open about it. He initially looked at both of my hands because there were very similar symptoms in the hands, aside from the pains that I was feeling from the other open carpal tunnel. He gave injections in both hands. He started therapy, and we tried a round of a couple of injections in both thumbs and wrists, which within 2 to 3 days were totally ineffective. And we then decided, because of the circumstances, he would start on my right hand, and he did the basal joint, and he did the minimally invasive carpal tunnel on my right hand, which was July 7th. And then I was doing extremely well, and within 6 weeks, he did my left hand. But on my left hand, he had to do the basal joint, he did an open carpal tunnel, and also a release of the Guyan canal, which, because of the nerve damage that had been created. I think I maybe took 1 pain pill or 2 pain pills. I have no pain in the palm of my hand, and I have no numbness or tingling, and it's been 4 weeks. So I was absolutely thrilled that it could be resolved, it could be corrected, and I'll be skiing and doing horses and opening doors as a realtor, hopefully very quickly. I would highly recommend getting a second opinion. I drive all the way up from Fort Myers. I drive an hour, and I would come up in a heartbeat. You know, and I already recommended him to several people that I know. I don't wake up during the night with my hand going to sleep. It's still early for my thumb. I'm getting used to my thumb, and I've got full range of motion. I've actually got full range of motion in both hands with both thumbs already, and one thumb is only 4 weeks out of surgery. Once we decided on the surgery, it was done very quickly. It was not something you had to wait to be scheduled for weeks and weeks, which I think helps reduce the anxiety. I think they were very aware of any kind of pain management. He had a type of pain management. It was actually an ice pack that they put on in the operating room after they've done surgery, and they wrap it. So the first week you have constant flowing cold ice and cool, keeping your hand cool, which I didn't have before. It was trying to keep an ice pack on it, and so the pain was reduced dramatically by constantly having chilled water go around. That was set up ahead of time. They set up it with the surgery center. The surgery center called me, followed up immediately with any requests that I had or any inquiries, made all the contacts with the insurance companies, and handled it all. I hadn't had any surgery since I was a freshman in college, and in the past 3 years or 2.5 years, I've had 8 surgeries. And by far, this was the best experience. And it wasn't just the outcome of the procedures that were done, it was the treatment that was given. It was the attitude of the doctor. And his attitude is like none that I've seen. He is more of the old school type of doctor, and I certainly wish we'd see more of them. I've referred other people to him. I feel very strongly that he's probably one of the best professionals, and even if I had something else wrong with me, I'd probably call him for a recommendation of who I should call, because I trust his expertise as a physician. I tell him that the carpal tunnel is probably one of the easiest. It probably competes with having a wisdom tooth out. The basal is far more involved, and to have two done together was a lot. But and people may evaluate that. I work full time, and I wanted both hands to be working together, and that's why I did them very close together. I'm a professional, and I just needed to get out and be able to get back doing what I'm doing. So I think that depends on the type of help that people have at home. You don't need lots of it with the basal joint, but you do need some help. There's no question I wish I'd come here first, because it would have saved me at least one surgery, and I would have been on the road to recovery months ago. Right now he's the love of my life because of what he's done and the interest he's taken and the amount of energy and the caring. You know, I come from a medical background. My family, we were all physicians. The moment you call one of his nurses, or people are totally receptive to listening, calling back, you get an immediate response back. You don't have to wait 3 or 4 days in the next week before you hear back from the medical staff in here, which I think is my idea of what makes a superior doctor.